The AVMA takes its first step in declaring pet obesity a disease. Welcome back to Off-Label Veterinary News, your source for commentary on animals, medicine, and practice life. If this is your first time, do me a huge favor and hit that subscribe button so we can reach as many veterinary colleagues as possible. Let's jump in to a story that broke at the annual AVMA conference. More than 2,500 years ago, the father of modern medicine, Hippocrates, wrote that being overweight posed several health risks and could lead to sudden death. In veterinary medicine in 2018, we don't have Hippocratic writings to rely on, but we do have an increasing mountain of evidence to support that excess adipose tissue in dogs and cats can lead to several serious diseases and decreased life expectancy and diminished quality of life. In 2018, at the annual American Veterinary Medical Association conference held in Denver, Colorado this year, the AVMA Board of Directors, along with the Future Leaders Group, approved and ratified our Global Pet Obesity Position Statement, a document that we've been working on for nearly 4 years. Along with my co-authors, Dr. Julie Churchill from the University of Minnesota and Dr. Alex German from the University of Liverpool, we set out to establish 3 primary goals for the discussion around pet obesity. Our first objective was to establish a uniform definition of pet obesity. To accomplish this, we scoured the human literature and enlisted the expertise of veterinary colleagues around the globe. We decided upon a 30% above ideal weight, or a BCS of 8 to 9 on a scale of 9, as a definition of pet obesity. Now, we understand that there are limitations to these arbitrary cutoffs, but we felt like following the human guidelines that this was a good establishing point and had certain epidemiological impacts that we felt were very, very important. Our second objective was to adopt a universal body condition score, or BCS, for dogs and cats. Currently, there are 3 commonly used BCS scales around the globe, and we felt like the profession needs to come under one BCS to avoid confusion. For example, if you say that dog is a BCS of 5, the next question you must ask is on what scale? We settled on the 1 to 9 scale, using whole integers as the best and most ideal and validated of the BCS scales. We understand that many colleagues have a preference for one of the other scales, but we feel that adopting a universal BCS scale is essential for us to unite around the issue of discussions and treatment of pet obesity. Our final objective is for the veterinary profession to formally recognize canine and feline obesity as a disease. Obesity as a disease has a long history in human medicine. In 2004, Medicare required all language referring to obesity as not a disease to be removed. In 2008, the Obesity Society formally declared obesity as a disease, and then in 2013, the American Medical Association declared obesity a formal disease. We believe that by declaring canine and feline obesity a disease, we will positively impact the quality of life, life expectancy, and care of the pet patients that we serve. Pet obesity also meets the AMA definition of disease, which is an impairment of the normal functioning of some aspect of the body. It demonstrates characteristic signs or symptoms and causes harm or morbidity. In addition to the American Medical Association declaring human obesity a disease, it's also recognized as a disease by the World Health Organization, the National Institutes of Health, the Food and Drug Administration, the World Obesity Federation, to name but a few. My co-authors and the Association for Pet Obesity Prevention believe that pet obesity is a complex physiological condition with many causal factors, many of them out of our patients' control. We believe that pet obesity causes suffering, contributes to ill health, functional impairment, reduced quality of life, serious disease, greater mortality, and that successful treatment, although difficult, provides tremendous health benefits for our pet patients. The Global Pet Obesity Position Statement has been approved by several leading veterinary organizations and is currently under review by most of the world's leading veterinary bodies. I'm sincerely grateful to the AVMA Board of Directors and Future Leaders Group for not only supporting our global pet obesity position statement, but for granting us a half day at the annual conference to packed rooms of veterinary colleagues discussing the ins and outs, definitions, trials and tribulations, treatments, and tips around pet obesity. This warms my heart, knowing that other veterinary professionals are just as passionate about preserving the health, well-being, and longevity and quality of life for the pet patients we serve, and nutrition and the management of obesity is one of the foundations of preserving that sacred bond. If you'd like to read the statement, visit petobesityprevention.org. And if you work with an organization that would like to be a signatory on this important document, please contact us via the website. Well, that's it for another edition of Off-Label Veterinary News. If you like content like this, go ahead and hit that subscribe button and share this content with a veterinary colleague so we can reach as many of our peers as possible. Until next time, keep living that off-label life. Bye.